Welcome to Big Butts No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the episode for you today? As promised, I'm bringing you plastic surgeons from across the country that can help you achieve the look of your dreams. And today, I am so excited about this hidden treasure that I found for y'all. And his name is Dr. Edgar Bedolla here in Houston, Texas. Thank you for being on the show, Dr. Bedolla.
Thank you for having me. I really appreciate you giving me the time to kind of meet you and talk to your patients as well, and hopefully have them understand how I approach the practice of plastic surgery.
Absolutely. You guys are in for a treat, y'all. We're going to be talking about your favorite thing, which is combination procedures. So for our listeners who aren't familiar with you, Dr. Bedolla, why don't you tell us a little bit about yourself? How long have you been in practice? What made you decide to be a plastic surgeon?
So I have been a fully trained practicing aesthetic plastic surgeon now for about 7.5 years. My story is a long one, just most other surgeons, especially plastic surgery. I am from Mexico originally, grew up in Dallas, and actually studied to be a general surgeon initially. And it wasn't until late in the game that I did a rotation in plastic surgery, and then just really kind of fell in love with the challenge, the technique, the anatomy, the knowledge that you have to really kind of help shape and mold things. It was something very different than what plastic surgery offered, and so that's the reason why I decided to pursue it. I'm a little bit of a tinkerer, so I like to kind of play with things, and plastic surgery allows me to, also not only it helps me take care of patients, but also lets me tap into the artistic part of my personality. So I trained in Miami, University of Miami, for plastic surgery, and I've been in practice in Dallas for five and a half years, and recently moved to Houston. I've been here now for about a year and a half, and I'm currently down in Clear Lake.
We love it. We love Houston. As y'all know, I'm based in Houston, so all of my Houston surgeons are just my favorite. So, Dr. Bedolla, we're going to talk about some really exciting things that to you is something you do every day, but to our listeners, it's something that maybe they're considering and then they don't know a lot of information about. And that is about combining procedures to do something that has been termed the mommy makeover. Why don't you tell us a little bit for our listeners, what is a mommy makeover? How do you combine procedures? And I really want our listeners to know, is it something that can be done together, or do they always have to separate their surgeries out?
So I think it's important to understand that mommy makeover is kind of an inclusive term for a list of combination procedures. A lot of times that includes having a breast procedure done at the same time as you're having some body type procedure. And it can be any combination, right? Breast augmentation or breast augmentation with a lift, included with a tummy tuck or just Lipo 360, or even a tummy tuck with Lipo. You can add a BBL. Sometimes you can do Lipo in other areas like the arms, the thighs. So I think when people refer to mommy makeover, it's kind of a global term, but in essence, it just means it's kind of a combination procedure of several body parts. So you're doing maybe 2 or 3 different surgeries all at the same time. Now, the benefit of that is that you have one recovery, you have one surgery, one time being under anesthesia. And so that's kind of really the benefit. Now, the downside to that is that it's not for everyone, right? You have to be obviously a patient who is healthy enough to be under anesthesia for, the length of time that the procedure is going to be. And it also depends on kind of the scope of the procedure, right? For some patients, for example, like a massive weight loss patient, if they're going to require a big, long circumferential tummy tuck, that's where the tummy tuck goes around the entire body. That may not be able to be combined with another procedure, and so you'll have some surgeons who maybe won't do that. Some of it does come down to experience because you want a surgeon who is efficient, fast, and he's able to do these combination procedures quickly and kind of minimize your risks of being under anesthesia and healing and recovery. So does that help answer, I think, the question?
Absolutely.
Okay.
Yes, definitely. So there's a lot of debate online about doing multiple procedures at once. And I know I'm constantly looking at the Facebook groups and reading the comments, and there's a big disconnect of patients who are wanting to get it all done at once, just have one time recovery, but they're coming across surgeons that are maybe telling them, no, we need to separate all of this out. It's too much surgery. You're not, I won't do it. So for my girls who are out there who are considering what should they be looking for?
So I think when you talk to the surgeon, it's important to kind of establish the length of the procedures for the surgeon, right? I think with experience, like I mentioned previously, is you do become a little bit more efficient. You're able, for example, when I first started, I would maybe do an augmentation with the lift and would take me 4.5, 5 hours. Now it takes me 2.5 sometimes, So that's what makes it easier for more experienced surgeons to be able to offer combination procedures. So I think when you're looking for those patients who are looking to kind of do a mommy makeover, combine some of these procedures, it's important to kind of ask the surgeon, oh, okay, well, what's the length of time you expect for me to have these procedures? I will tell you that most surgeons, including myself, who consider ourselves safe surgeons, we really try to minimize your time under anesthesia to less than 6 hours. Anywhere between 6 and 8 hours is acceptable. If you're over 8 hours, unless it's a reconstructive surgery or something of that sort, then that gets a little bit more, it's not that it's not doable, because yeah, you can do it in the right setting, right? If you're in a hospital, if you have admission privileges postoperatively, then that may be an option. But I think trying to find the happy medium where you're combining the procedures, but you're also being safe in terms of having the patient only be under anesthesia for a certain amount of time, and that's usually within 6 to 8 hours, then it's very, very doable and it's safe, right? I do a bunch of combination procedures. Like you mentioned, right? The benefit is it's one surgery, right? It's one time off of work. You don't have to, in 6 months, ask your job for another 3 weeks off of work. You don't have to worry about not being able to take care of your kids for, another 3 weeks at the end of the year. So that is really the biggest benefit, right? And you also get kind of all the result all at once, which is kind of nice too.
I love combination procedures. I always, when I'm talking to my girls, if you can do it, go for it. Go do the multiple procedures at once. The debate is on doing tummy tuck and BBL at the same time. So I'd love to talk a little bit about that. So a lot of patients will be hesitant, as their surgeons are, to do a tummy tuck and BBL at the same time, because it's like, well, I can't lay on my stomach and I can't sit on my butt. How am I supposed to rest?
Mm-hmm. So do I do that combination of tummy tucks and BBLs, but it is with that understanding. I think the conversation that I have with my patients is it's going to be hard. It's not easy. It's not an easy recovery. You're probably going to hit me for a week or two, but after that, After the third week, after the sixth week, when you're looking at the results and you're seeing everything really kind of come together, that's when patients are super happy. And thankfully, I haven't had anybody say, "Oh no, I wouldn't have done that again." But it comes down to just preparing, understanding that it's not going to be the most comfortable, right? Because you're right. I'm worried about the tummy tuck. I'm also worried about my butt. There's really no good way for me to position myself. Typically, in my practice, what I have patients do is lay on their sides, but I tell them you're going to be like a little rotisserie chicken. Every couple hours, you're going to go from one position to another position. Now, the fat, once it's injected, it does depend on the available blood supply of the tissue, right? Any fat transfer, any graft. And so it is important to minimize the amount of pressure so that that newly injected fat can kind of grow its own blood supply. And so being very cognizant of moving around, flipping around, really does kind of minimize that. 3 weeks is usually my goal in terms of no pressure on the butt. But after that, you can slowly kind of return to normal. And like I mentioned, after that 6 week, you're super happy. It is definitely doable.
Absolutely. I love a combination procedure. I had my tummy tuck and BBL done at the same time. It sucked, but I'm so happy I did it at the same time. I'm glad I didn't try to split it up because I probably would not have gone for the second surgery.
Yeah. The
Probably
other
not.
thing that I'll say about that too is just it is nice for us to be able to do the liposuction. I can count on one hand the amount of times that I've done just a tummy tuck, right? Because a lot of the contouring does come from the liposuction. The waist, the hips, the whole hourglass shape. And so not wasting that precious fat during the time of the tummy tuck with the liposuction, it is very nice to be able to kind of inject it and to fill in those areas, especially the hip dips, which, that seems to be a problem area for most.
Absolutely. So while we were off air, you and I were talking about fat grafting and BBLs and how actually I just had a post on my Instagram about this that a BBL does not mean a big, big butt. It's more about shaping. So why don't you tell us a little bit about BBL?
Yeah, so definitely I think in the media or in the Instagram space or just kind of the social media space, BBL kind of became synonymous with just this huge, big bubble butt, right? But that's not the case at all. For me, my goal, and I tell this, and I have this conversation with my patients, is the goal is shape, right? It's really to accentuate your shape and to really fill in areas where you've lost volume. And for everyone, women in particular, especially after pregnancy, you have this big fluctuation in weight. And a lot of times, not only do you end up with a little bit of skin laxity, but you end up with some volume deflation, right? That volume goes away after the hormones, after the pregnancy, and it just doesn't really come back. And so fat grafting, and as plastic surgeons, we use fat grafting all over the place, in the face and the arms, and it's kind of a very specialized tool. It's kind of a little magic trick that we have that allows us to really kind of restore volume. And so a BBL, really what that means is just transferring fat into the buttocks area where you can restore volume. And like I mentioned previously, the hip dips tends to be a pretty important spot. And then just adding volume so that, you fill in that space so that, you have a nice, pretty shapely butt. And if you look right behind you, that's exactly what the goal is, right? It's just to bring out those shapes, bring out that pretty kind of hourglass and that heart shape that, that I think most of us find very aesthetic.
Absolutely. So while we were off air, you also were talking about the amount of fat injected. So for our listeners, they love this stuff. They love hearing about how many cc's of fat go into the butt cheeks and what's normal and what's too much and how much should they ask for. These are questions they have.
Yeah. So it obviously depends on your goals. I think what's important for you as a patient to discuss with the surgeon is, what is my goal? What do I want to get out of this surgery? How much volume am I really looking for? That's where wish pictures kind of come into play. I think a lot of us as surgeons really like to see what you like, what you consider to be the right amount of volume. And then from there, our experience will be able to help get you to where you want to be. Or we may tell you, hey, listen, you don't have enough fat for this, or we may need to do a secondary procedure in order to kind of help give you more volume. I will tell you that, I'll introduce the other term, I'm sure you've heard of it, the skinny BBL, right? For women who just don't have enough fat. You don't need a lot of fat. And even if you're skinny, I can guarantee you, most of us, or at least I know I can, extract, a liter or two off of you. And use that in order to really just kind of expand those areas. I think there's no real magic number, but it just depends on what your goals are. Safely, obviously, there's an issue with safety. Some surgeons inject 2-3 liters. That's probably not the safest per butt cheek, right? Because we're talking about each individual side. I think anywhere between 400 to 1,000 is what most surgeons typically inject per side. And again, that just kind of comes down to your goals, how much volume you actually need, which areas you're wanting to expand or reshape. In the BBL kind of practice and literature, we're starting to use ultrasound guided kind of BBLs now, which is what I do now. I have found that it's reduced the amount of fat that I need because I'm able to kind of safely really put the fat or inject the fat underneath the superficial layer of fat. That space seems to expand really nicely. It keeps you out of the muscle, which is the biggest risk factor, and probably the reason why you hear, a lot of bad things about the BBL. And one of my mentors in Miami actually kind of spearheaded this whole using an ultrasound guided kind of BBL, Pat Pasmino. He's really kind of advanced the science in terms of what we're able to do with how much we have. And so I've found that using the ultrasound to really guide the fat where I need it has kind of reduced the amount of volume that I need. And it doesn't give me, sometimes you'll get these like skin changes above the butt, especially if the fat's injected really superficial. And that's really kind of diminished that as well.
I love it. So for my
I got a little
listeners,
technical. I'm sorry.
we love it. We love the technical.
Yeah.
We love the technical. So for my listeners, getting a big butt's not by accident, y'all. Sometimes it takes 2 to 3 rounds to get you, if you have dreams of a big old booty, and maybe that first round is not going to get you there. You might need another one. So for my girls who are like, oh, I want to get a BBL, but I'm scared it's going to be too much. Girl, that does not happen by accident. They pay a lot of money to get it there.
Yeah, that's absolutely true. I think most of the butts that you see, dancing on TV, a lot of times they've had a couple of procedures, at least 2, sometimes 3, in order to get to that volume,
Mm-hmm. So I also want to talk about the safety aspect. So for my listeners, something you just touched on was that there's this theory online that BBLs are dangerous. The most dangerous procedure, BBLs are the deadliest procedure. And although I I know that there have been people that have lost their life, and I feel for them, and they're the reason why I do my show. They're the reason why I advocate for patient safety, because I feel like they just didn't know any different, or they didn't know that they were doing this procedure in the wrong hands, or that that surgeon injected under the muscle. They just don't know these things. And that's why I do my show, to educate, so that they can make better decisions for themselves when they're having their consultations and they're asking questions. So as far as ultrasound, we've had a episode about it before, but it was maybe a year and a half ago, and I feel like it has advanced even more since then, since a year and a half ago, where now I see most of the surgeons using ultrasound.
Yeah, so obviously that has changed. Maybe 4 or 5 years ago, our societies, the American Society for Plastic Surgeons and the American Aesthetic Society of Plastic Surgeons, kind of commissioned a group of surgeons to kind of look into the dangers of BBL. Obviously, in Florida, Miami area, again, I know some of the surgeons that participated in that study, or really were part of the groups that looked into it. And what they found, at least in their findings, was that a BBL can be very safe as long as you do several things to mitigate risks, right? Most of the injuries and deaths that have happened due to BBLs have been a direct result of fat being injected into the large veins in the butt. So a little bit of an anatomy kind of segue, but underneath the butt, so the butt, or the gluteus maximus, there's three components to it, obviously. It's a really nice, big, healthy muscle, and that's why fat tends to do pretty well when grafted to the butt. But right behind the butt are some pretty big vessels, and that includes, veins that go down to the leg, and they have a lot of kind of negative pressure because they're draining all that blood from your lower extremity up into your heart. And so what they found was that those injuries were a direct result of injuring those veins. And and you don't have to inject the fat into the vein, it's literally just having fat around that area. And that vein would suck a piece of fat up and it would go to the lung. And unfortunately, it's a pretty devastating complication. What they found was that staying above the muscle, essentially, and ensuring that you're not going into the muscle, and that's the reason why the use of the ultrasound kind of came about, is the ultrasound can really show you specifically if you're above the muscle or not. There are some surgeons that would say, oh no, I can feel the muscle will twitch, or the muscle will, if I go into the muscle. But I will tell you, even in experienced hands, it's a very subtle thing. It's not and if you're injecting, a large volume of fat, it gets to the point where you don't really feel that muscle twitch or that muscle show you where it's at. And so having the ultrasound has reduced that risk significantly. And our societies, and it's a law now actually in Florida, because a lot of these injuries were happening in Florida, that if you're going to be injecting fat, it needs to be done under ultrasound guidance. And so you've seen that adoption of the ultrasound kind of spread to a lot of our surgeons, including myself. And as mentioned previously, it does give you kind of an extra safety net in order to make sure that you minimize those risks. Now, that's not to say that accidents don't happen, because it can happen to anyone, right? But I think in the right hands with the right experience, and that's where vetting your surgeon, and that's where you obviously do a great job of really kind of educating your audience about going to the right doctors, making sure that they are plastic surgeons, because you have cosmetic surgeons, right? You have guys that go to a class or maybe do 6 months or a year of cosmetic surgery, and it takes a lot of experience. It's a very nuanced. It seems easy. It seems like, oh, I'm just going to put fat here, but there's a lot of stuff that's going on underneath. There's a lot of things that we're doing to really kind of minimize those risks. And so finding that right surgeon, finding someone with the right training, someone with, who's staying on top of these things, right, is where it's going to really be important. And when it comes down to it, it's your safety, right? It's your peace of mind. So you want to make sure that you've got the surgeon.
Absolutely. I have so many thoughts about that. I think I go on a rant about cosmetic surgeons compared to plastic surgeons every episode. So I'm not going to go on a rant today because I want to save the rest of our time for something that's also important, which is something that you mentioned to me during while we were off air was that you trained and you learned liposuction techniques from one of the leading plastic surgeons in liposuction, Dr. Hoyos. So I would love for you to tell our listeners what is the difference? How is his technique or those techniques different than the techniques that you had learned in prior to learning those?
Yeah, so I think the one thing that's kind of special about plastic surgeons is that we just want to continue to get better, right? And part of that is really being critical about your results and really being, really not being complacent with, oh, I'm pretty good at this. I'm just going to keep doing it the same way that I've been doing it for years, right? I think for most of us, we enjoy that challenge. We enjoy um, being able to kind of get better. I first came across Dr. Hoyos before I even graduated training. He was down in Miami at one of the conferences that we have called the Baker Gordon meeting. And he's introducing these new techniques at the time, right? Kind of revolutionary techniques about high definition liposuction and all this stuff. It's now kind of mainstream now. He's actually done a really nice job of showing everyone. And it's important too, because it would be sad if he would just keep his techniques himself. But he's got a course. You can go down to Colombia. You can spend some time with him there. You can actually do some on hand, kind of training with him. He's written a book, obviously, videos. He speaks pretty much at all of our aesthetic conferences, and really kind of shares his technique and his approach to liposuction. I would say the biggest difference is just how he treats and how I see also lipoing, and it really comes down to seeing it as sculpting, right? Because anybody can go in there and just extract a bunch of fat and think you're going to make a difference, but it comes down to understanding the anatomy. It comes down to understanding where the negative spaces are, right? He describes it as a negative space, but where the shadows kind of lay within the body and the natural anatomy. If you look at a picture of an Instagram model, right, who's super fit, is always working out, you see where those shadows are. That's why you can see the six pack, or you can see their body looks lean, their body looks long, and it's because they have those shadows right in the perfect spots. And so that comes down to extracting fat in the right places. Another thing that I discuss with my patients is my goal is not to take away all your fat. My goal is really to be very strategic about where we're going to subtract the fat and to create this space and to really kind of shape and mold things the way that it should look. So by the time I'm done, it should look like you've been in the gym and not with me, right? So that's my goal. That's kind of how I approach this. That's the biggest difference, I think, as we've progressed our skills in lipoing, is really just understanding that and really accentuating those things and not just going in there and extracting a bunch of fat.
Absolutely. I think that's a perfect segue into this next topic, which is also, I see it so much in my DMs of patients who just want all the fat. Take every single drop, suck it all out. Why don't you tell my girls why we don't want that?
Yeah. Obviously, like we talked about, right? If if you just go in there and you just take everything away, and you've seen these patients walking around, right? You've seen them in their bikinis. Everything just looks flat, right? There's no, yes, there's no volume there, right? There's no fat there, but there's also no shape, right? It literally just looks, oh, you've had lipo. Those are the patients that get asked, oh, you had lipo, right? Like, where did you get your lipo? The other thing with that too is if you're not very strategic about where you take away the fat and the level that you're at when you're taking away the fat, you get issues with contouring, right? You get contour irregularities. So you've seen that too. You've seen patients where their stomach just doesn't quite look right. It looks a little bit lumpy. It looks a little bit wavy. It looks like they've had liposuction. That's what happens when you go after all the fat, right? If your goal is just to remove the fat, then you're not gonna create something that's nice. Now, I think when patients ask me that question or have that request from me specifically, I try to kind of understand what they mean by that, right? Because a lot of people don't want that. A lot of people just want to, yeah, maybe I'm a little bit overweight. I just want to get rid of the overweight stuff. But again, it's having this conversation, explaining to them the importance of shape and the goals, and again, most of them are pretty happy, and once you educate them about that stuff, and they trust you, right, to give them the results that they want. And so, if you're looking for all your fat to go away, it's probably not the right answer. Yeah. And the other thing too that's important is post-operatively, right? Because it's easy to look good, feel good, everything fits right, and then you kind of slip off a little bit, and then you gain weight, and you gain weight in areas where you previously weren't really gaining weight. So that's different too. And big part of the patients who have long-lasting results is maintaining your results, right? Being able to still work out, and it's easier when you're looking good and feeling good. I'm telling you to go to the gym, right? Once you feel good, once that once those Spanx fit the way, yeah, you want them. It's easy to go in the gym and stay there, but it is very important to in regard with regards of maintaining your results.
Absolutely. I think you touched on something that we should talk about, which is um, I can't tell you how many times I've heard I had lipo and now all of my fat goes somewhere else, or my fat spread, which you did gain weight in other places, but your fat didn't go from one place to the other. Why don't we explain that a little bit to them?
Yeah. So the pretty cool thing about liposuction is that we are physically removing fat, right? We are physically extracting the fat. So those areas where and we're all different, but for most of us, it's kind of the middle abdomen area, the love handles, the lower back. We're physically removing that fat. So when your body, post-operatively, when your body's looking for places to store the fat, those fat cells aren't there anymore. So you're going to see an expansion of other areas that maybe were not as noticeable before that, right? Couple that with the fact that you're not gaining weight the same way in the areas that were lipoed, it definitely feels like your fat has moved or has gone somewhere else, traveled, yeah. But really what you're just seeing is you're seeing kind of the natural expansion of the fat in your other areas relative to the expansion of the areas that have been lipoed. So again, super important to maintain your results and to have long lasting results is keeping up with things and making sure you don't have any huge fluctuations in weight. 5-10 pounds is not a big deal, right? You're not gonna notice it. I mean, you may notice a little bit in your clothing, but most people won't tell you, hey, what happened here or what happened there. But I'm talking big fluctuations in weight, 20, 30 plus pounds. Yeah, things are gonna look very different. You're gonna feel very different as opposed to before your procedure.
Absolutely. Thank you for explaining that to us.
Absolutely.
So, Dr. Bedoya, before I let you go, I always ask my surgeons this. Are you team drains or no drains?
That's the other thing about surgeons is we tried everything. Is we tried everything. Um, I find it unfortunately a necessary evil, and I'll tell you why.
I love drains.
Yeah, uh, without the drains, most surgeons will leave the incisions open, right? If you're talking about just lipo, um, they'll leave the incisions open so that fluid drains and has a way of escaping, right? It's also very dependent on compression. So you have to be very on top of compression and making sure that you don't give it, you don't let any fluid collect. And I'll touch on the reason for the drains. So the drains for patients who don't really understand why we need drains is whenever we're doing a procedure, whether it's liposuction, whether it's a breast, I hardly ever use drains on breast, but for example, just a big breast reduction or a tummy tuck, we're opening and creating spaces that don't normally exist, right? We're lifting that skin off of the abdominal wall. And those then become potential spaces where fluid can collect because our body is primarily water, right? 65% water. And that water that's not in our cells is what you see as swelling. It escapes those cells. It goes into these spaces, and then if there's nothing there for it to drain or physically removing it, then you get what's called a seroma, right? That's an accumulation of fluid in a space. Or you can get a hematoma, right, which is a collection of blood in a space. And drains, though they don't prevent hematomas, they do kind of give you an idea of if there's something going on in there, or the most important part of the drain is getting rid of that fluid, making sure everything drains away. I treat drains a little bit differently. I'm pretty quick at removing the drains. They serve their they serve their purpose pretty quickly, and so I'm pretty fast at removing the drains. They don't stay in for very long. I've tried doing the retention sutures when you do the tummy tuck. A lot of times what happens with those, so retention sutures, I guess I can explain that a little bit. For some surgeons who don't use drains, in order to minimize that space, in order to tack things down, what they do is they take sutures and they actually suture the skin all the way down the abdominal wall to where the skin it does a couple of things, right? It's supposed to get rid of the space so that fluid doesn't accumulate, and it's supposed to take tension away from the scar. So that suturing, sometimes you can end up with little divots all the way down on your skin, right? And it's okay because they go away, right? As the suture dissolves, it goes away, and you don't ever really see it long term. But every suture gets tacked down to the muscle, right? Down to the fascia, to the muscle. So I've found that it's a lot more painful to have retention sutures than it is to have a small little drain down at the bottom of close to where the incision is. I also am able to get rid of all the tension by closing everything in layers and closing the fascial layers appropriately down below the skin, so that there's really no undue tension on the incision. And so I've done everything, and I think the drains, unfortunately, though they're a pain in the butt, they're the easiest to kind of deal with. They're the easiest to explain, and they have the least kind of long lasting effect. So,
I
team drain.
agree. I agree. So for whoever's keeping track, whoever my listener who's keeping track, there's another one for team drains. So, Dr. Bedolla, where can my girls find you if they want to come see you? Oh, wait, I'm starting a new segment or a new question that I'm going to ask all of my surgeons because I know my listeners want to know. What is your typical price range? And I know your coordinator is the one who handles all of this, and you might not have this answer for me, but if we could just get a starting price range for a typical mommy makeover, what is that?
So
He's like,
if
hold
we're
on, let me
combining,
text my coordinator.
yeah, yeah. Let me see if she texts me back. So typical range, what you should be paying for a procedure, right? That's a combination procedure, including something with the breast, something with the body. Any combination of those procedure is probably anywhere between the 18 to $30,000 range, right? Because everything is very individualized. I can't specifically tell you, oh, this is exactly how much it's going to be, because some patients need a breast augmentation, some patients need a breast augmentation with a lift, some patients need an extended tummy tuck versus just a regular tummy tuck, right? Some patients want to add liposuction to their thighs. So it's a very, very, very individualized procedure, right? Even though it's a combination procedure. But I think obviously there'll be some surgeons that are a little bit more expensive. They'll want you to pay for experience. I have a lot of experience, and that's still kind of within the range, right? Anywhere between 18 to 30,000, depending on the combination of procedures. The other also thing to consider when talking about finances is you're only paying for one anesthesia team. You're only paying for one surgery facility fee team, right? As opposed to breaking things up individually. You're having to do that twice or three times sometimes, depending on the procedure. Now, that being said, for some patients, that's the safest way. That's the best way. And so I don't say that that's not a good idea or discourage it. But for those patients who are candidates, who are able and willing, right? Because you also have to be willing to do it. Yeah, combination procedures are probably going to be the best bang for your buck. They're going to be the best in terms of the time off of work and your recovery. It's a little bit more taxing. It's a little bit more painful, but I will say that patients who come into the procedure with that mentality that, okay, yeah, it's going to suck for a week. It's going to suck for 2 weeks. They do the best. And then like, oh, that wasn't that bad. Patients who are not ready for it, patients who are like, oh yeah, I'm just going to walk through this. It's going to be fine. It's tougher than you think, right? I've done all kinds of surgeries, right? Heart surgeries, transplants, all kinds of surgeries. And I will tell you, a big mommy makeover is one of the hardest surgeries you're going to have. And that's not to scare people. That's not to scare your listeners, but it's really to be realistic about things. Because the more you understand that, and the more you're able to kind of prep yourself mentally and prep yourself in other ways, and you mentioned this off camera as well, is getting ready for your procedure, right? That about a big part of your recovery is getting ready for everything, so that there's no surprises, so that you know what to expect, so that everything is smoother, and then not being rigid, obviously, afterwards, not thinking, oh, I should be here by now, I should be there by now. It's just take it as it goes, right? Everybody's different. You have to recover nicely, safely. So
Absolutely. Thank you so much for giving us that. And for my girls who want to come find you, how can they find you?
So I'm down here in Clear Lake. I work at the Clinic for Plastic Surgery. All my socials, including Instagram, Facebook, YouTube, my handle is at Bedolla MD. So that's BEDOLLA MD. And that'll get you to my Instagram, Facebook, and YouTube. I'm working on more content, obviously, to get that out, but you can find me there. My website is eb-plasticsurgery.com. And you can see there some of my patients. I have some blogs. I've written some blogs in terms of same thing we've talked about today, how to get ready for procedures, what to expect, recovery, those kinds of things. Hopefully we can integrate some videos in there as well for patients, but that's where you can find me.
Great. So for my girls, if you want to come see Dr. Bedolla, you know how to find him. And thank you so much for being on the show. We really appreciate it.
Absolutely. Thank you so much for having me.
And with that, you guys, I'll see y'all next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.